these are my inspirational books. I think Professor Mohan sir actually mentioned about these 3 books. One is by Diabetes, the biography by Robert Tattersall. Robert Tattersall is a diabetologist practicing in UK who was instrumental in noticing a special form of diabetes which was called MODY. Now the name is changed to monogenic diabetes. So he first documented young monogenic diabetic patients first, and then Michael Bliss, the most authentic discovery of insulin, because obviously Michael Bliss had all the access to the documents and other materials that was available in the University of Toronto, because he was the head of Department of History at the University of Toronto. So Michael Bliss wrote this book, The Discovery of Insulin. If you should have a book, if you're a doctor, I think this should be the one. So it's the most interesting, readable history of the discovery of insulin. Then he wrote another book, a personal biography about Banting, which is very good. Again, Professor Mohan sir said that Banting is a unique character where he is a very good doctor. At the same time, he acknowledged that contribution is superior. In any research work, we need to know that there is a superior, there is a professor who has got all the knowledge and they give guidance. Because the small instructions that changes the course of the research project to the right direction. Banting never realized that MacLeod's contribution was vital in every step of his discovery of insulin, but unfortunately they never saw eye to eye till they died. So just moving on. Now the next question is why we should read about history. What's the need for it? Then I want to quote Isaac Newton. This sums up this question, the answer to the question nicely. If I have seen further than others, it is by standing upon the shoulders of giants. That means any discovery is made based on some premises which was worked by the previous or predecessors. So any research is built upon other people's work. So we should recognize this, and whatever we do today to our diabetic patient, whatever treatment we do, so we need to realize that a lot of people over these centuries toiled for us to get to this position. So we need to remember them, thankfully. That is why this entire webinar is all about. So there is always a human angle to every great work. When it comes to insulin discovery, all of us know that the young, financially struggling orthopedic surgeon Banting and a biochemistry student, third-year biochemistry student, Charles Best, discovered it. This most of us know. But there is a big human angle. This is a very famous photograph where you can see Banting and Best standing on top of that building where they did all the dog research. And this dog standing there is often quoted wrongly as Marjorie. It is not Marjorie, it's dog number 410. So they were researching on so many dogs and they numbered the dogs, and this dog's number is 410. So Oskar Minkowski and Joseph von Mering removed the pancreas of dogs and found that the dog became diabetic in 1883. So it was about almost 50 years prior to what Banting and Best were doing. So the first dog research, or the research on the pancreatic ligation of the dog or removal of pancreas of the dog, started with Oskar Minkowski and not at Toronto. And how many of us know that at least 5 others did successful experiments with pancreas before Banting? First is Eugene Clay. This old man. In 1904, he in fact extracted the pancreas and did experiments successfully. Came George Ludwig Sulzer in 1906. Then Ernest Lyman Scott, 1911. Israel S. Cleaner, 1919. and Nikolai Pawlowsko, 1920. All these people did successful extraction of the pancreatic juice, and then they even published, but in some obscure journals, and for various reasons, they couldn't get to the level of glory which Banting and Best got. So in the future webinars, we'll be covering their work also. Many of us may not be aware that the least qualified of the four, the quartet, the famous quartet, MacLeod, Banting, Best, among the all the three medically qualified, only Best was the biochemistry student. Later on, he went in UK to finish his medicine, and he went on to become the most accomplished scientist among the four. And these are the two most famous pre-insulin era physicians. Discovery of insulin changed their practice directions upside down trajectories. Eliot P. Jocelyn on left with a small girl is a very famous physician from Boston who made wonders with insulin therapy with his patients, and his hospital at Boston grew by leaps and bounds. Whereas Frederick Allen on the right side, he was more famous than even Jocelyn around the pre-insulin era. It was called Allen era of diabetes research. In 1913, Harvard University Press published his 1179, which was called as Studies Concerning Glycosuria and Diabetes. This book was published by Harvard Medical Press, and he was an authority, and he had the most number of patients before insulin got discovered. He had most famous patients as well. One of his patients was Elizabeth Hughes, the daughter of the Secretary of State of US. She was under his care, surviving with his Allen starvation diet. But for various reasons, his practice folded after insulin came into the market. So one famous physician did extremely well, the other one went into oblivion. And this is Elizabeth Hughes, whom I just talked about, who was the daughter of the Secretary of State of United States of America around that time. And even insulin to get popularized in US, a famous personality was required. Like if Sachin Tendulkar promotes a drink, it becomes famous. Like that, for insulin, her introduction into the was required. So when she went to Toronto, the entire US media went with her, covering her progress on a daily basis. So every day the newspapers covered her progress. She has gained weight, she's talking normally, walking normally, all that. So more people in US came to know about insulin because of this famous lady. And Banting was a very popular doctor to his patients. He used to get long, detailed letters, and he made it a point to write a reply back to them. Louis Jovanovic, on the right side, you can see the lady who is Louis Jovanovic, who is no more, was a very famous endocrinologist at Santa Barbara. Professor Mohan sir actually brought her to Chennai to deliver a lecture on pregnancy diabetes once. I was fortunate to attend that lecture. She has done seminal work in pregnancy diabetes, especially with Mexican women. And she had type 1 diabetes herself. Once when she searched old documents in her attic, she found this letter on the left side, which was written by her grandma to Dr. Banting. Actually, she realized later that her grandma was a patient of Dr. Banting himself. So such was the pride after seeing this letter. Sadly, Banting had a very bad personal life. He had 2 broken marriages. On the left, you see Marianne Robertson, his first wife after their marriage. They are getting out of the church, 1924. And right, you can see Henrietta, his second wife. This picture was taken in 1939. So both marriages were broken, and his family life was in a mess. And Priscilla, this is Priscilla White. She was a very famous physician at Jocelyn's clinic in Boston. She managed pregnant diabetic patients at Jocelyn Clinic. She an authority. She was an authority in pregnancy diabetes, and she was Jocelyn's most favorite assistant. And she made a very famous statement that the living diabetic child is the most outstanding medical accomplishment. When Banting visited Jocelyn clinic after discovering insulin, both of them met and dated for some time. In one of the European meetings, they skipped the session and went for skiing too. Then Jocelyn later came to know of this affair, and he discouraged their relationship, and better sense prevailed for Priscilla. She went on to become the most famous diabetologist after Jocelyn. And finally, George Minot, he was a type 1 diabetic young doctor who was on the verge of death before insulin got discovered. He was saved by insulin in 1922. And he went on to get the Nobel Prize in 1934 for his work on pernicious anemia. He found liver therapy for pernicious anemia and was awarded a Nobel Prize in 1934. This is one of the indirect relationship to insulin and Nobel Prize, not the direct one. So one of the patient getting Nobel Prize. So these are the human angles to insulin discovery. From this, I will go into the actual presentation. So we'll see more such human angles in the webinar series, which are going to be rolled out every month. This is again an infamous unscientific use of insulin. Actually, insulin was also used to treat mental disorders like schizophrenia. Doctors used insulin to induce hypoglycemic coma, which was believed to improve their outcome, which was utterly wrong. Then for quite some time, this therapy was used in US and Europe and then was abandoned later. So we shall cover these and more in the upcoming webinars. In this presentation, we are going to look at the various contributions of individuals not connected necessarily with one another. In different eras, they placed a stone or two as their contribution to the foundation, which was later built fast by their researchers. This is the timeline. We need to understand a little bit of this timeline. You can see there's a before, we all know there's a BC, before Christ, and the AD is after birth of Christ, Anno Domini, or the year of the Lord. Now, the common terminology is BC, before the common era, and AD is converted into common era, CE. So we don't use BC, AD anymore. It is BCE and CE, common era. In ancient Egypt, medicine and religion was inseparable. The most famous priest-physician of around 2630 BCE was Imhotep. His name was Imhotep. Egyptians imagined up to 46 channels in the body similar to the tributaries of the Nile. They believed evil spirits blocked these channels and caused diseases. So obviously their remedy for all the diseases was to unblock these channels with purges, laxatives, and emetics. That's how they treated their patients. This is a place called Luxor in the banks of Nile, where most of the papyrus were discovered. And there are many preserved papyrus documents. Papyrus documents are from the Egyptian tombs. Kahun papyrus was the earliest. It is from about 1800 BCE. It's all about gynecology. It vividly described about gynecological procedures. And Edwin Smith papyrus was surgical text. It details about 48 case histories of various surgical disorders. And it is even considered as a very good text even now in modern times. And Eber's papyrus 1550 BCE was the longest, which is going to detail about the diabetes. And Ebers purchased it. Georg Ebers was a German Egyptologist who was researching the pyramids. Once he happened to visit a shop near one of the pyramids, there he saw a papyrus, old document, and purchased it for some meager money. And then later he realized that it was a wonderful document and it turned out to be a gem. It's called Eber's papyrus. It is now preserved in a museum in Germany. There is a vivid description of polyuria and its treatment in this document. That is how this is the first document which details about the symptoms of diabetes, the earliest document. So 1550 BCE. That's about 3,500 years back. And then came our own Sushruta. We know he's an Ayurvedic physician. Ayurveda itself means life knowledge. There are two major works in Ayurveda. One is Sushruta Samhita, the other one is Charaka Samhita. Sushruta belonged to 6th century BCE. So he was before Common Era, before Christ, 6th century. Sushruta described diabetes as a disease of honey urine. He was far ahead of his times. He noticed ants getting attracted to the urine, and whenever he saw that, he felt it clinched the diagnosis. He believed that it's common in indolent, overweight people, and it ran in families also. He was talking about family history of diabetes. And he prescribed physical exercise and vegetables as its treatment. He considered the disease in lean people as more serious. So that means he understood that there was a obese type 2 variety as well as lean type 1 variety. So he considered the lean type 1 variety as more dangerous, serious. Then comes Hippocrates. Hippocrates is known as the father of medicine. It is often said Hippocrates did not recognize diabetes. It's not true. He wrote a book called the Book of Epidemics. Of the Epidemics was the book written by Hippocrates. So he described a patient condition where the volume of urine was in excess of what they drank. So he was mentioning about polyuria in this book. Then came Celsus. He is a 2nd century Greek philosopher. He was against early Christianity, and his medical teachings were suppressed by the popes for many centuries. Again, he wrote nice textbooks, but it was not allowed to be published by the Christian rulers. The first description of symptoms of diabetes was by Aretius. This is again a wonderful document written by Aretius in the 2nd century AD. You can even read in diabetes is a remarkable affection, not very frequent among men, being a melting down of the flesh. So very vivid description of how diabetes affects your body. This is from 2nd century AD. Then came Galen. Actually, a lot of stumbling blocks were created because of his work. I'll tell you why. Galen's teachings dominated Western medicine for over 1,000 years. He belonged to 160 AD. He described thirst in 2 cases, and he felt diabetes is a kidney, and he mentioned diabetes is diarrhea of urine. The description was okay, but most of his teachings were wrong, and people believed him in toto. And next 1,000 years, because of the belief in his ability, they believed whatever he wrote, and they just continued. No research progressed. The other reason was the Christianity's suppression. These 2 factors worked against the advancement of medicine around that time. Nobody challenged his concepts. So then came Avicenna. Avicenna was a Persian physician. He belonged to this period, 980 to 1037. So he thought diabetes may be primary or secondary to a disease. Again, he was far ahead. Like he was mentioning about primary diabetes as well as diabetes secondary to another disorder. He gave a comprehensive list of symptoms of diabetes. He evaporated urine and noticed the residue was like honey. He also listed the complications. Some of the complications like gangrene, carbuncles, phthisis. He mentioned phthisis. Phthisis in the olden times was tuberculosis. So one of the complications of diabetes. So he mentioned tuberculosis, one of the complications of diabetes. And today we all know that tuberculosis and diabetes has got bidirectional relationship. If anybody diagnosed with tuberculosis, we need to check for the presence of diabetes. And in any diabetic patient, we need to look for the presence of tuberculosis. So he was so far ahead of his time. His work was unfortunately not known to Europeans because of the church control. So to crown it all, William Osler described Avicenna as the author of the most famous medical textbook ever written. He noted that Avicenna's canon of medicine remained a medical Bible for a longer time than any other work. So that was his contribution. And then came this important person. He was Theophrastus Bombastus von Hohenheim. So he belonged to this period, 1493 to 1541. He had a long name, but he called himself as Paracelsus. I think we covered Celsus before. So after Celsus came Galen, and 1,000 years the research was blocked because of his teaching. Then this person came, called himself as Paracelsus, and what he did, he burnt all Galen's work in a square at Basel in 1526. Actually, he's a Swiss guy. So he lived in Switzerland, and Basel is in Switzerland. In a square at Basel in 1526, he burnt Galen's work, which was audacious at that time, because Galen was most revered around that time. He ridiculed those who were examining urine to make a diagnosis. He advised rather to analyze it chemically. So this was the first prescription by Paracelsus. He is also known as Martin Luther of medicine. And he wrote, "Do not despise my writings because I am solitary, because I am new, or because I am German." And this was a book which was written by one of his disciples about the pissing prophets. So it ridicules the doctors who make a diagnosis by examination of the urine. So they were advocating an analysis of urine rather, trying to find out what is in it. Just don't look at it and diagnose. Then came Thomas Willis, the famous Thomas Willis. We know Circle of Willis fame. So he published a very good treatise on diabetes. He mentioned that urine was sweet, but fails to conclude that it is due to the sugar content. He identified that urine is sweet, but he did not mention that it is due to sugar. He wrote a book called Diabetes or the Pissing Evil. And again, the description of diabetes was very vivid in his book. Then came Matthew Dodd. He was a physician in Liverpool. He established that due to sugar. This was the first person who actually identified that the sweetness in the urine was in fact sugar. It contained sugar. Then came William Cullen, who was an Edinburgh physician who lived in this period, 1710 to 90. He identified two forms of polyuria because people were just talking or writing about polyuria. He found that there were two forms. One was diabetes mellitus, which is more common. The other one is diabetes insipidus. So he was the first one to talk about diabetes insipidus. And then came John Rollo. John Rollo was not a physician. He was an army surgeon in UK. In 1797, actually, he admitted a patient for a few months in the army hospital and thoroughly analyzed this particular patient and wrote a treatise on diabetes. So he thought sugar in urine came from digestion of vegetables in the stomach. So he prescribed a diet with animal food, eliminating greens. Obviously, he was thinking about all the vegetables getting absorbed in the stomach or getting converted into glucose. So he advised patients to avoid vegetables and take animal food. That was his diet. He eliminated greens from the diet. Even though the concept was not entirely correct, but he mentioned that any patient with diabetes should follow the doctor's instructions. So he talked about the compliance. Here within this red highlighted area, you can read, the patient was thoroughly demonstrated with and told the consequences of repeated deviations. So he advised the patient to follow what the doctor is saying, and compliance is a big factor in all the non-communicable diseases. And he published 2 cases of diabetes mellitus, this treatise again. And this was his diet, John Rollo's diet, for his patient Captain David Meredith, who was in the hospital for about 4 months. You can see bread and butter, plain blood pudding. It is from blood. And blood, then old meats, fat and rancid old meats. So all breakfast, noon, dinner, everything as same kind of food without any greens. So this was his diet. The credit for being first with a systematic diet for the treatment of diabetes goes to John Rollo. Then came Michel Eugene Chevreul. He is considered as father of lipidology. Actually, he was the one who, since he was a biochemist, he found that the diabetic urine contained glucose. Actually, he proved that it was glucose in 1815. And to his credit, even when he was 96, he was practicing, he was doing his research. And in this photograph, you can see Chevreul when he was 96 years old, still in his laboratory, still doing research work. Then came Carl August Tromer in 1841. He devised the first test for glucose. What he did, he mixed urine with blue colored copper sulfate and heated it. So then it became red colored cuprous oxide. Red colored cuprous oxide was found. And if red colored cuprous oxide was found, there is the presence of glucose. So there was a simple test devised by Carl August Tromer. Then came Herrmann von Fehling. We all know Fehling's test, 1812 to 1885. He improved the copper test. He vastly improved the copper test so that it can be easily used. This improvement came in 1849. Then came an important person. He is Dr. Frederick William Pavy. He lived between 1829 to 1911. He was the first to talk about the relationship between the degree of hyperglycemia and glycosuria. Actually, he felt if the blood glucose level is very high, blood sugar level is very high, then there will be more glucose in urine. So he was talking about the level of hyperglycemia. This was in 1862 and this was his paper. But Pavy, so before moving on to the next slide, Pavy spent his entire lifetime treating diabetic patients at the Guy's Hospital, London. So he treated only diabetic patients, which was not heard of around that time because physicians were treating all kinds of diseases. But Pavy chose to treat only diabetic patients, but everyone knows diabetes is not curable. So a lot of people thought Pavy was wasting his time in treating diabetic people. So one of his fellow physicians at Guy's Hospital was Sir William Gull. Sir William Gull was a famous physician who actually had the credit of first describing anorexia nervosa. He described first myxedema and Gull-Sutton syndrome, which is also called as chronic Bright's disease. And he was the first one to describe vividly about paraplegia. So he is a very famous physician around that time. He mentioned what sins has Pavy committed or his fathers before him, that he should be condemned to spend his whole life seeking the cure of an incurable disease. That was his lament about his colleague Pavy wasting his time. Then Claude Bernard. Claude Bernard, again a famous physician, lived between 1838 and 1878. He was the first one to talk about the liver. Now we know the research has moved from pancreas to the liver, because we know the hepatic insulin resistance plays a vital role, and fatty liver, NASH, so many new concepts are coming in. So this man first talked about liver stores glucose as glycogen, and he was the first one to reveal that normal blood also contains sugar, because everyone was writing about the blood sugar content of the diabetic patients. No one bothered to check the blood glucose level of a normal non-diabetic person. So he checked the glucose levels of normal people and found that normal people also had presence of sugar in the blood. That was a finding around that time. And he was also talking about hepatic oversecretion of sugar, which we know that is like the reason for high fasting glucose. Nocturnal hepatic glucose output is a fasting hyperglycemia. So he even talked about that. And for his seminal work in a lot of physiological experiments, Louis Pasteur called Claude Bernard as he is a physiology itself. It's a very famous statement. Louis Pasteur called Bernard as he is a physiology itself. This is a handwritten note by Claude Bernard. First time he wrote glycogen. The glycogen word was coined by Claude Bernard. Then came Pierre Adolf Pierre, a French physician, again a very famous physician who was instrumental in propagating percussion as a clinical examination tool. So he was an expert in percussion, and you can see in this picture, by just percussing, he can just delineate the lung territory or liver, internal organs. By external percussion, he can draw the actual positions of these organs. And in patients who have got enlarged organs, his diagnosis used to be very vital around that time. So he became very famous by publishing a lot about percussion, and he devised percussion instruments also. And he was the one who introduced the terms toxin and septicemia. So this is called organographism. By percussion, he was just drawing the structure of the organs externally on the human body. So why he is included in this presentation? Because he wrongly thought that since the diabetic patient is losing a lot of sugar in urine, it is better to replace it. So he advocated oral replacement of sugar lost in urine, which was an utter nonsense when we think about these times. But then he was so famous, but then his thought process was somebody is losing something, replace it. So sugar lost in urine should be replaced, which was a wrong concept again. Then came a lot of dietary regimens. Arthur Scott Donkin in 1874 advocated skim milk diet. Skim milk diet, in this diet, they were giving skim milk at regular intervals with the exclusion of other foodstuffs. So only skim milk will be given to the patients. Then came Karl von Nuden, who is a very famous German physician. He advocated oatmeal diet. He lived between 1858 to 1944. Karl von Nuden was an empathetic doctor. He was the first one to talk about treating all poor patients. So he advocated the hospitals for poor patients as well in Germany. And his oatmeal diet was very, very popular around that time. And if you go into the recent literature, this was a paper published in Practical Diabetes as latest as June 1st, 2020. It talks about short-term dietary oatmeal intervention in adults with type 2 diabetes, a forgotten tool. So even now we are still talking about von Nuden's oatmeal diet. Sir William Osler, who is considered father of medicine, he wrote a very famous book called The Principles and Practice of Medicine. So before Harrison and other Cecil textbook of medicine, all those famous textbooks came into vogue. This was the textbook followed by generations of medical students. And in the chapter on diabetes, he advocated von Nuden's oatmeal diet. So what he advised was 250 grams of oatmeal to be combined with 250 grams of butter and whites of 8 eggs to be divided in 4 portions in 4 times of the day. So you have to divide everything into 4 portions and give it as breakfast, lunch, supper, and dinner. In between, coffee, tea, or whiskey may be taken. That was his advice. And Sir William Osler is a very, very famous physician. We can even do a webinar on his contributions alone. That much of contribution is from him. There are 2 famous statements from him. All of us should know. He has said, listen to the patient. He is actually telling you the diagnosis. That means whenever we examine the patient, you just listen to him. Don't interrupt the patient. Allow the patient to come out with the symptoms and what they feel. From the way they are described, you will get the diagnosis. The second statement was, the primary duty of the physician is to teach the patients not to take medicines. That means unnecessary medication should be avoided. So a very famous physician, Sir William Osler. Then came Franco-Prussian War in 1870. So this war actually opened a lot of scientific ideas. when this war erupted, the whole population went in for prolonged starvation. So a lot of people starved. And in 1870, this French physician, his name was Apollinaire Bouchardat. Bouchardat was considered as founder of modern diabetology. So he observed that during the war, during the starvation, the glucose disappeared from the urine of some of his patients. When he checked the urine sugar of some of his patients who were starving, he found that the urine glucose became nil. So he advised people to eat as little as possible. You can see manges les mons possible. In French, it means eat as little as possible. If you eat more, you will be converting the food into more glucose. And he also said at a time when 300 ml blood was required for glucose estimation, for each glucose estimation, you have to give 300 ml of blood because the testing procedures were so primitive. Bouchardat, he wrote that this daily measurement of glycosuria guides patients like the compass that guides a sailor on unknown oceans. So he was advocating the measurement of glucose in urine, say 1 plus 2 plus 3 plus. With that value, you can manage diabetes. That was, so he was advocating quantitative measurement of glucose in urine. And he was the one who talked about diet, patient education, even self-monitoring. So again, he was a physician who was far ahead of his times. He introduced the personal responsibility of the patient for his own treatment into diabetic therapy. This was his cardinal contribution. This was the statement made by Eliot P. Jocelyn about Bouchardat's contribution to medicine. So he made the patients responsible for their own. That's what we talk about self-empowerment today, patient education and self-empowerment. These concepts are even in vogue today. And a lot of fad diets got published around this time. So commercial interests came into play. A lot of companies started marketing. If you take this diet, you will get cured of diabetes. One such diet was with uranium. Can you imagine somebody taking uranium as a treatment for our diet for diabetes treatment? So then BMJ started this series of investigations into all those commercial diets to see whether they work or do more harm. This was the original BMJ paper about these fad diets around that time. And before even the cure for diabetes was discovered, people started realizing that diabetes brings in complications too. So Adolf Kussmaul, who lived between 1822 to 1902, he was the first one to describe the diabetic coma in a classic way. So we all know Kussmaul-Keen respiration, which happens in people with diabetic ketoacidosis. So he was the one who described it very vividly, and this is his tombstone. And then Bernard Nounin, who lived between 1839 to 1925, he coined the term acidosis. Few of his students, he was a famous professor in Germany. A lot of his students became big shots later on. So few of his students injected hydrochloric acid in rats and found that they started having acidotic breathing. And then they injected alkali into the rats. They found that the rats became better. So, but the same experiments could not be repeated in humans because humans cannot tolerate hydrochloric acid into their circulation. So, but at least they could prove that acidosis was the reason for that Kussmaul respiration. Julius Hirschberg, actually he was an ophthalmologist who recognized diabetic retinopathy. He was so specific that diabetic retinopathy is different and separate from hypertensive retinopathy. So he could tell whether it is due to diabetic retinopathy, the changes are due to the diabetic retinopathy or hypertensive retinopathy. He was also a historian. Like he researched about the history of ophthalmology. Can you believe he just researched about the history of one field, ophthalmology, and he wrote 11 volumes of history. So these 11 volumes contained actually 16 books. These are the actual volumes of history of ophthalmology. And William Prout in 1848 said albuminuria is an ominous sign. So he was talking about the chronic kidney disease, the diabetic nephropathy of diabetes. So he found that anybody with protein in urine, they are going to die soon. It's an ominous sign. He was the one who discovered that stomach juice contains hydrochloric acid. And he also classified food into sugars, starches, oily bodies, sugars and starches, oily bodies, and albumin. We know sugars and starches are carbohydrate, oily bodies are fat, and albumin is protein. So he was the first one who did proper classification of foodstuffs into these three major groups. And before concluding, one or two slides more, we are coming to the end of this presentation. I want to go back to Frederick William Pavy. We had a discussion about him in the previous slide. So he in 1862, he described the diabetic nerve damage. So he also said impotence is also a common symptom of diabetic neuropathy. So I want to read this in toto. So like he said, the diabetic patients, they cannot feel properly in their legs. Their feet are numb. Their legs seem too heavy. Darting or lightning pains are often complained of. Mere pinching of skin gives rise to pain due to hyperesthesia, or the patient is unable to bear the contact the dress against the skin. So this is called allodynia. Even the dress touching your skin causes severe pain, which is called allodynia. He was describing allodynia. And these pains are worse at night. This is again very typical. Nocturnal pain is very common in diabetic neuropathy. He recommended opium or continuous galvanic current as a treatment for painful neuropathy. For superficial pain, he advocated a cautious application of liniment aconitum. These are the modern day equivalents of TENS and capsaicin cream. So this was his book, Dr. Frederick William Pavy. And finally, Indians, what happened to India around that time? Again, Professor Mohan mentioned that he was researching a lot about the Indian contribution to the history of diabetes. I am sure he holds a very important position there. But this is one of the papers which got published in Social History of Medicine, Diabetes in the Tropics, Race, Place and Class in India, 1880 to 1965 by David Arnold. There, it mentions about a doctor who is Dr. T.M. Nair. Dr. T.M. Nair, Tharavat Madhavan Nair, who was an Edinburgh-trained physician. He started the Justice Party along with Sir Pitti Tyagaraya Chetty. He was into politics also. And most of you will be knowing that there is a Dr. Nair Road. Dr. Nair Road connects Pandi Bazaar and G.N. Chetty Road. Unfortunately, he died due to diabetic gangrene when he went to England to present a paper. So Dr. Nair said, of late years, I believe the deaths from this disease have been increasing. He's talking about diabetes and the deaths due to diabetes. And the loss to the humanity at large by the death of brilliant men who are cut away from the prime of life by the development of this insidious disease has been extraordinarily heavy. So this statement was made in 1888. Can you imagine? So, and this conference was conducted in University of Exeter in 1907. So there they dedicated one entire session for tropical diseases. Actually, this particular session by British Medical Association was dedicated to tropical diseases, and a lot of Indians presented papers there. This happened on August 1st, Thursday, the second day of conference, where Dr. Roy Koilas Chundar Bose Bahadur, he was from Calcutta. This was his presentation. I am just going to read few sentences before concluding this presentation. What he said in that conference: with progress of civilization, of high education, and of increased wealth and prosperity of the people under the British rule, the number of diabetic cases in India had enormously increased. Next, he said, I did not agree with those who believed that carbohydrates were the only factors of diabetes, for meat eaters were not immune against this disease. And he also said, I have seen regular group of diabetic patients in families. So he was talking about family history of diabetes also. So this particular paper, actually the paper, I just showed you the paper, the previous paper, Diabetes in the Tropics. Actually, interestingly, in the references, it quotes Professor M. Viswanathan's publication. So I think Professor Viswanathan and Dr. Mohan, they have published a lot again about tropical diabetes. So naturally, this paper mentions their name also in their references. That's very interesting to know. So with that, we come to the end of this presentation. It is called papyrus to pump because we started with Eber's papyrus, and we will move on to the puzzles of the pancreas. What we have covered is the knowledge before people identified the pancreas as a seat of diabetes. So the focus got shifted to pancreas as a research area in 1989. So the next presentation will be talking about the research that happened with the pancreas before the Toronto group started their work. So this is titled as Puzzles of the Pancreas. Thank you for your patient listening. And